Hi guys, good morning, good afternoon, good evening, according to your time and location. Welcome back to my page. My name is Joy. This is Joy at Talk Show. Please like and follow this page. Share my video on your notification. Please don't forget to subscribe on my YouTube channel, Joy Head TV. Thank you for watching. Our topic today is TB, which is tuberculosis. What is tuberculosis? Tuberculosis is a fatal disease that can affect almost any part of the body, but develop mainly as an infection of the lungs. Okay, so tuberculosis is an airborne disease and is a communicable disease. We have pulmonary tuberculosis and we have extrapulmonary tuberculosis. Pulmonary tuberculosis affects the lungs, while extrapulmonary tuberculosis affects other organs outside the lungs, like the brain, the spine, the kidney, the bone, the joint, the abdomen, the lymph node. It affects it. So, what are the causes of this tuberculosis? What is the cause this tuberculosis? Tuberculosis is caused by a bacterium known as Mycobacterium tuberculosis. And as I've said before, I said it's an airborne disease. Now, disease wey be say you fit contact through air, and a communicable disease wey be say you fit contact from one person to another. So na be tuberculosis. For example now, if person wey get this TB now, if e cough, if e sneeze, if e laugh, so e get wetin e dey release for air wey dem dey call aerosol droplet. E go release am into the air. So this aerosol droplet now, one of it contain about 1,000 of this bacterium, which is tuberculosis. If the person wey be say e no get am, e inhale only one of the droplets, e go get this tuberculosis. So another way wey you go fit still transmit am na be overcrowded. Maybe you dey where room wey be say ventilation no dey and people many for the room, and one of the people wey dey the room dey get tuberculosis. Person fit easily get am because no ventilation, because no inflow of air and no removal of stagnant air. Like as jail be now, or prison, person wey dey inside prison now, we know say prison say dem dey jam pad, and one of the person wey dey get TB. So every other people among them, they fit easily contact this tuberculosis. Okay, so another way wey you fit still contact am na be drinking unpasteurized milk from cattle. Like na milk wey be say dem no treat, dem no screen, because if like slaughter now, if dem wan kill meat, dem dey screen am to know if any of them get tuberculosis. Now you dey consume milk wey be say dem no treat, wey dem no screen, you fit easily get tuberculosis from there. So na be the way of transmission. So wetin we go talk about na be signs and symptoms of TB. How you go take know say you get TB, or person wey near you, how you go take know say person get TB? Number one na weight loss. The person go reduce, e go lose weight. Okay, e go lose weight. Number two na be loss of appetite. You no go get appetite for food. Then persistent coughing. The person go dey cough for more than 3 weeks with sputum, which is spit dey follow am. The person go dey cough, spit dey follow am for more than 3 weeks. And another thing wey go follow am be say that thing wey dey flow for our vein wey red, I no wan mention am because of Facebook guidelines, e dey follow am. You know say that person get tuberculosis. Na sign and symptoms of tuberculosis. Another one be say fatigue, that is tiredness. The person go dey weak, e go dey tire all the time. You know say that person get TB. Another one na be pain in breathing. The person dey breathe, e dey feel pain, you know say the person get TB. Then night sweat. The person dey always dey sweat for night, most especially at night, you know say na sign of TB. Another one wey we go still talk about be say if person dey lose strength, the person dey lose strength all the time, and still dey feel chest pain. So all these ones wey I mention na be sign and symptoms of tuberculosis. So make we come still talk about the risk factor. Risk factor be say who dey at risk for this TB. Okay, who dey at risk for this TB? Number one na be people living with HIV/AIDS. They dey at risk because get the video wey I first do when I talk about HIV. I can't talk the relationship between HIV and TB. When I say person wey get HIV, dey easily get TB because the person lungs don already weak. The immune system no fit dey fight any disease again. And TB now, we say e dey affect lungs. Okay, So as e dey affect lungs, the immune system don already weak, so the person go come break down, e go affect the lungs, and the person wey get the HIV go easily get TB. I come still talk say the person wey still get TB, if maybe hospital now person get TB, if like maybe say I come say like 1,000 people get TB now, if you screen them, I say maybe 60 of them or 70 fit dey get, they go get HIV if you screen them. Because why? TB dey affect the lungs and HIV dey weaken the immune system. If the immune system don weak, person go easily contact TB. So the risk factors na be HIV. Person wey get HIV dey at risk. And another one wey dey at risk na be children below 5 years, maybe pikin wey be say dem newly born now. Na cause am Nigeria, especially for Nigeria now, person, no be only Nigeria, na everywhere. If you newly born baby now, dem dey always dey give BCG. Why? Because e go prevent TB for am, e go prevent all those cough. Because person wey come visit baby now fit get all this cough wey be say the baby lungs never strong. As a baby, the lungs never strong, e fit easily contact all this TB. So that is that for the risk factor. Another person wey dey at risk na be person wey dey homeless, wey no get where e dey stay, dey at risk. Another person wey still dey na be obesity. Person wey dey fat dey at risk of TB. Person wey get high blood pressure dey at risk of TB. Then people wey dey jail, wey dey prison, dey at risk of TB. Okay. So another person wey still dey at risk na be people living with diabetes. People wey get diabetes, dey at risk of TB. So thank you for watching. Tomorrow we'll continue from where we stop. Thank you so much. I love you guys. Bye. Good night.